my name's Ashley Abshire. I'll be your student nurse today. Can I get you to state your full name and date of birth? Okay. Well, today the doctor has ordered an IV for you, so I'm here to just go ahead and start that IV. Let me wash my hands, provide privacy, and we'll get started. Now, as far as the IV, are you right-handed or left-handed? Okay, so you're right-handed, so I'll put the IV in the left hand. Now, do you have any allergies, like allergies to betadine or any shellfish or latex or anything? Okay, no allergies. Well, I'm going to go ahead and set up my supplies, and then I'll get started. Okay. So I'm actually going to set up the bag first. I feel like that's just a little bit easier. So I would rip the bag open downwards like that. Using sodium chloride, I need to check the 5 rights of medication administration. That would be right drug, right dose, right route, right patient, and right time. So what I would do is get my IV tubing here. I need to make sure that it doesn't hit the floor or anything. I've already got an alligator tip on one end. So what I'm going to do is untangle it first of all. Okay, it is now untangled. I'm going to go ahead and take this blue cap off. I'm also going to take this cap off and insert it into this bag, making sure that it's completely on there. Now I'm going to hang it. I need to prime this line, so I need to make sure that it's all the way closed. Take it over to this trash can. Need to fill this vial up about halfway. Okay. And then I would slowly open it over the trash can. Make sure it doesn't have any bubbles in it. There we go. No air bubbles, so I can go ahead and close it. And put it right up here to be used in just a minute. Now I can go ahead and start on the getting the cannula ready. I'm going to go ahead and set up all my supplies. Go this way. I've got the extension set right here. Got the 10 milliliters of water. Just got a flat barrel. Put this on here like this. It's got 10 milliliters. Now I need to take this and I need to put this on here like this. I'd also need to flush this line, just a little bit of water. Make sure it's all out. Then I need to put it back in here. Make sure it stays sterile. Okay, and then I need to open this pack up. This is an IV start kit. So in here we've got some cotton, a tourniquet, which we'll use that in just a minute. Got some tape, which I need to go ahead and get out and ready. having some difficulty with my tapes. So you need to see it here. It does not want to rip very well. Okay. You can go ahead and throw these parts away. I've got my Tegaderm, which I'll use later on. I've got Chloroprep, which I'm actually going to use alcohol to clean the site, so won't need that. I need these gloves. Okay, so the very first thing I'm going to do is I'm going to look for a vein site. The ones in his hand, they actually look really good. They're nice and straight, not hard or anything, so I'm going to go ahead and use those. First thing I'm going to do is clean the site. I need to let that dry completely. For this, starting this IV, I'm going to be using a blue 22. So after that has dried completely, we go ahead and open this up just a little bit. So then we'll put on my gloves. Actually, I'm going to put on my tourniquet first because I think that'd be a little bit easier. And since it's going to go on his hand, I just need to put it up here just a little bit. Have to get it straight here. I need to make this nice and tight. Okay, now I'm going to go ahead and put my gloves on. Make sure my alcohol's dry. It is. Alright, I'm going to go ahead, get my cannula ready. I'm going to insert it bevel up at a 10 to 30 degree angle, about like this. I'm going to push it in until I hear the pop, and I'm also going to look for flashback, which is when I see blood. Then I'm going to advance it a little bit further, push this, and then I'm going to withdraw my needle. Insert it in the sharps. Now I'm going to release the tourniquet now that I have it in there. I'm going to go ahead and put a piece of tape on the cannula so that it stays down. Not too much, just kind of loosely. Make sure it just stays there. The next thing I need to do is I need to flush the IV site. So I'm going to take my extension set, put it on here, make sure it's actually on, and then I'd flush the rest of the 10 milliliters of water. Okay, now I can go ahead and disconnect the syringe. I need to kind of fold this around. Actually, I'll just put it right. Actually, I'll put the syringe back on because I need some stability while I put the Tegaderm on. So I'm going to go ahead and do this first. Take off my gloves. Got the Tegaderm. I'm going to take the back off first. This little cut piece goes at the top. So I'm going to put this on like this. Then we need to pull the white pieces off. there's actually a place for me to initial, date, and gauge. So I would write, of course I'd write my initials, the date, and the gauge. And then you can just stick that back on the side for the next person who comes along, so that they know when it was placed and what was used and who placed it. Okay, the next thing I need to do, now I can go ahead and tape this. So now I can remove my syringe. And I can just kind of fold it around, tape it. I could put a piece of cotton under the cannula to stabilize it, but I'm not really going to worry about that because I feel like it's pretty stabilized right now. Alright, so now we're ready to connect the bag. So, put this here. This already has an alligator tip on it, so all I need to do is take this off. And put this right here, like this. When the patient's ready to go, all I need to do is set the fluid and turn it on. So now I can go ahead and stop the IV fluid. So to do that, I would of course, stop it right here first, and then I would take this off the alligator clip. Hang this back up here, like so. I would tell the patient first, I would tell him what I was doing. I was getting ready to take his IV out. Make sure I get some tape off of here. Start pulling it just a little bit so I have some room to work with. Just going to pull it up to the cannula. And then what I would do is I would put on gloves real quick. And once again, tell the patient that I'm going to remove the thing. Shouldn't be too painful. Go ahead and take a cotton swab and hold it, give it some pressure and occlude it, and I would just go ahead and slip the cannula right out, tape and all. And I would need to note that the cannula is intact, it's not bent or anything, and then I can go ahead and throw it away, and then I would just need to keep pressure on it till it stopped bleeding. So that's, and then I would just go ahead and throw away all my supplies, clean out my area, and take off my gloves and go document. And that's it.